Hello, viewers and listeners. Yeah, yet welcome to another edition of the program, Midday Vibe. Coming your way on Caliphate TV, transmitted on channel 141 on Star Times and on our social media handle on YouTube at Caliphate Radio and Television and on Facebook at Caliphate TV, as well as Caliphate Radio, transmitting on 91.9 MHz and on our website www.caliphatebroadcast.com. In today's edition of the program, we are going to be discussing about the measures taken to curtail the menace of child mortality rate in the country. As we all know, statistics have been showing how infants less than 5 years are dying in Nigeria, most specifically in the northern part of the country and the other parts, which leads or make some organizations to make move in ensuring that no child is dead because of such diseases that are causing infant death in the country. Among these organizations is Sight Savers, which come up with a program called SARMAN. In today's edition of the program, we will be looking at what is this SARMAN and what are the target of the SARMAN. With me in the studio, I'm honored to have the program officer Sight Savers Sokoto in person of Mr. Muhammad Ridwan. Muhammad, you are welcome to the show.
Thank you very much, and good morning to the viewers and the listeners in Sokoto.
All right, thank you, sir. So, sir, we have heard about this SARMAN, and we have been hearing about it for let's say, since last year. People have been hearing about it, though not much, but now that is back again. Someone would like to know, what is this SARMAN?
So, actually, SARMAN is an acronym,
Okay.
which means Safety and Antimicrobial Resistance of distribution of azithromycin to children from 1 to 59 months.
Okay.
And so it started with a pilot that was implemented across 6 states in Nigeria. In those 6 states, 52 LGAs were taken, and the pilot was implemented in those 52 LGAs across those 6 states.
Okay.
Here in Sokoto, we piloted in Wamako
Local
LGA.
government area.
And after the pilot, it was reviewed that the intervention was worthy to be implemented in the whole of Sokoto LGAs. And so it was kind of like expanded to cover the whole LGAs, 23 LGAs in Sokoto.
All right, sir. So the viewers and listeners would like to know, what are the rationale before coming up with this project or behind coming up with this project, SARMAN?
So WHO, as we know, is the mother body that looks out for the public health of every nation. So they've looked at all interventions that have been rolled out and then the effect those interventions have had. And also they've assessed the mortality rates of children under 5. And so they came with a rationale that for places that have mortality rate of more than 60 in every 1,000 of children, they are qualified to have an extra layer of an intervention to protect child mortality, which is called SARMAN. So evidently, it's just a distribution of azithromycin to children within those age to protect them from basically respiratory tract infection, which is one of the most things that affect children of those age that causes death, and also protect them against other diseases. Zithromax is a broad spectrum antibiotic, and so there are so many diseases that just taking Zithromax kind of like protect you from those diseases.
Okay, sir. Thank you. You have mentioned earlier that the program was piloted and now it is implemented fully. So, if I might ask, how many local government of the state are currently or this project is being implemented in now?
So, when we started the full scale up, we started with the 23 LGs. But out of these 23 LGs, there are other LGs that have had other interventions where Zithromax is used. And so they are at a stage where they have to undergo surveys to know the impact of Zithromax giving to kind of address trachoma, which is an eye issue. So those LGAs that are undergoing that particular survey are 3 in number. We have Silami, we have Benji, and Sabon Berni. So the first round of our scale up, we implemented in all the 23 LGs. But the subsequent round, the second and the third, we exempted those three LGs so that they can undergo their survey without having any issues related to it. And once that is done, they are also going to be brought back into the program of SARMAN, and then the implementation will cover the whole LG. So for now, for round 4 and 3 that has been done, we're only implementing in 20 out of the 23 LGs.
Okay, so this azithromycin you are talking of is a medicine, right? I think medication.
Yes.
So how, let me say, how influential or significant is it in the life of the children that are receiving it?
So the weather we're experiencing now is a weather where we see a surge in the respiratory tract issues.
That's when it comes to,
exactly. When it comes to children of that age.
Okay.
And azithromycin, luckily, is one of the most effective, safe, and most potent broad spectrum antibiotic that any medical practitioner resorts to. In short, it's more of like the last resort. When other drugs are used and there's no results, the next resort is AZT, azithromycin. So for us to have an intervention where these age groups are targeted, I think Sokoto is getting it right. And there's going to be an improvement in the mortality rate, reduction in the mortality rate of children within that age in Sokoto.
All right, viewers and listeners, this is your show, Midday Vibe, coming your way on Calipet TV, transmitted on channel 141 on Star Times, and Calipet Radio, transmitted on 91.9 MHz. And remember that you can join us on YouTube at Calipet Radio and Television, and you can listen to us live on www.calipetbroadcast.com. And for those using TuneIn, you can reach us at Calipet Radio. And in the studio today, we are discussing on the implementation of the SARMAN project in Sokoto State for children that are below the age of 5 to reduce the high rate of infant mortality in the state. And Malam Muhammad, who I'm having in the studio now, is the program officer of Site Savers here in Sokoto State. Malam Muhammad, now we have had the significance of this particular specific medication that you intended to use to reduce the rate of children death, because when someone say mortality, someone may not really get it. Death of children that are below the age of 5 in the state. So what now, you said there was a pilot in the previous year, per se. So now I would like to ask, are there any challenges first in the past or in the pilot phase before now implementing the full phase?
So in the pilot phase, because we're looking at just one LG,
that's
Wamako local government, it was easier for us to manage then. Challenges that relates to logistics, challenges that relates to even manpower, that's the HR component of the project, was easier to manage. But now looking at the broad spectrum where we're considering the whole state, there are challenges here and there, and so we have to up our game as supporting partners, supporting Sokoto State to implement this particular program, to ensure that we put in our best when it comes to training. We plan ahead of time to get our logistics arrangement right, and also we do a whole lot of awareness so that people are aware that an intervention like this is coming up, and then they avail their wards to benefit from it. So I would say when we started the scale up, there were challenges here and there, but after each successful round, there's been an improvement. You understand, because you already know the scope of the work, and then the challenges that you've had from the previous phase, and we planned against it. And I must say here that the Sokoto State government, through the leadership of the Ministry of Health and Dr. Farouk, has done a great job. They've supported the intervention so far. also, the implementing body, which is the Sokoto State Primary Healthcare Development Agency, have done a marvelous job.
I think
giving us the right.
I don't know how you get it, but you just read my mind, because my next question was about how are you working with, because sometimes when interventions come of such, people need to know that it is indeed with the awareness of their leaders. So I wanted to ask about how did you, or is this project solely owned by site savers, or it is a collaboration with the state government and maybe they are implementing partners?
So site savers is just a technical supporting partner in the implementation, but actually is the Sokoto State government through the ministry, leadership of the ministry, and the Sokoto Primary Healthcare Development Agency that are actually doing the implementation. Because all staffs and manpower are actually provided by the states. And so for us is to look inwards and say, okay, we need them to improve in this aspect, and then we give our advisories and provide that technical support to ensure that there's improvement there. But the implementation solely, we say, is Sokoto State that is implementing. So I say, well, just a supporting partner giving technical support.
All right, thank you very much, Malam Muhammad. Viewers and listeners, it's still a show, Midday Vibe, coming your way on Calipet TV, transmitting on channel 149 on Star Times, and Calipet Radio, transmitting on 19.9 MHz. Coming back to the studio, Muhammad. Now, there have been such, let me say, immunizations, because it is like an immunization, preventive measure. And we have been saying it ranging from polio, all the rest are, some are still going on. So, firstly, how is this project meant to be implemented? As in, how is this going to be carried out? Is it door to door, or it is just hospital or health facility based immunization?
Okay, so for SARMAN implementation in Sokoto, we're leveraging on the polio platform.
Okay.
So just the way the team, that's the polio team go house to house to deliver that particular polio vaccine to target groups, the same way SARMAN goes house to house to target those particular people, or let me say children within that target, to deliver the azithromycin. And it's free, just as for polio is, and it's very safe. The good thing about SARMAN is it has two components. It has both the mass drug administration component and it has a research component. Basically, what the research component looks at is to look at how safe is the medicine. As we give this medicine, are there adverse events or not? So if there are adverse events, this is something we need to take up with NAFDAC so that they can come in and advise and do the needful as an organization that regulates the use of medicines in Nigeria. So it's so far for the aspects where the researches are being done to look at the safety, which is championed presently by NIMA, the Nigerian Institute of Medical Research. So many samples have been taken and analyzed. From what we have, preliminary results has shown that AZT is quite safe. All right, thank you very much. So now, household, in a household now, they might have, I don't know, is it arranged in such a way that when they come, they will administer all, or it is different? Because someone may be wondering, why are these people with immunization trooping into my house? This one's came yesterday and this one came today. So I'll ask two questions here. Number one, is it like those giving polio are coming along with this azithromycin, or maybe someone is likely to see two teams? After this one, maybe the other time he's going to see another one. So to recoin your question, I think what you're asking of is it integrated with polio? So when we started the scale up, actually we looked towards integration, because evidently integration makes the whole intervention cheaper and easier to implement. You reduce contacts with the households. So, but we ran into some problems. Sometimes when you look at the modalities for administering AZT, first of all, is a POS. So there's an aspect that they have to reconstitute, add water to eat, you understand, mix it, measure, and all that. While polio is a fluid that you drop. You understand? So the challenge we ran into was the pace of movement. If you join these two teams and say they should work together, evidently polio is faster. And so they leave the SARMAN
behind
teams behind.
Yes.
And so issues of coverage came up at the end of the day. And then I remember in round 1, we had to increase more days for the SARMAN implementation to go on to be able to cover the whole of So we thought it wise that let's experiment another one where they work independently. You understand that they are not kind
attached
of like attached to polio and playing catch up.
Yes.
You understand? And so that's why this time around, yes, polio has finished their own implementation just recently, I think last week.
Yes.
And then SARMAN is going to take
over and continue from where.
Exactly.
Okay, so now when you started describing it, I like the part because viewers and listeners would like to know, because it's not every type of, like this azithromycin is not like the remaining vaccines people used to know. Before. It's just maybe injection or just a drop. But this one you are still trying to say is different. How will someone differentiate that this is azithromycin they are giving to his child, not any other drug?
Okay. For starters, when the team comes to your house, the first thing they are going to be asking is they are going to be asking how many eligibles they have in your house.
Like so if you look children at age
exactly
1 to 5.
So if you look at the target group for polio, there's a bit different. Polio is 0 to below 5, right? But for azithromycin, it's 1 month
to 5. Okay.
So if a child is not up to 1 month, it's not
eligible for.
So that's the first thing you look at.
Okay.
Once you hear them talking about the eligible children are from
1 month
to 59 months, you know this is AZT administration.
Okay.
The second thing is you're going to find the vaccinators having a container of powdered medicine, which they will request for water, which you, the household help, will provide, or the caregiver will provide for them to mix with the powder they came with. And then you ask for how many months the child is, depending on where the range of the child age falls. If it's from 1 month to 11 months, for that there's already a dose chart that they move with. And they know the dosage,
the quality, the quantity they should
supposed to give. And then if it's above 1 year old, there's a dose sticks where they measure height of the child. The height determines the quantity.
Okay, so you mean they mean with a stick that they use to measure the height?
They move with a stick.
Okay.
You understand? And so there are other things that you can look out for. There's an apron that these teams will wear. There's a bag that is customized with SARMAN that they wear.
All right, viewers and listeners, I think it's now quite clear that these vaccinators are different from other vaccinators in the sense that, number one, as he said earlier, they are coming with a medicine that's azithromycin, which is powder in nature, which they will require water from you, the household, to supply for them to mix the medication. And secondly, they have a stick, like a wood that they use to measure the height of a child if it's above a year. Right. All right. Thank you, Madam Muhammad. And now, coming back to the studio, and I hope now viewers and listeners will be able to distinguish between this SARMAN project implementers and the others, because someone will be asking, I've seen you yesterday. It's not like that. These ones are different and they target different issues. This one are concerning the diseases that kill the children before they attain the age of 5. All right. Muhammad, now, having heard about this, I would like you to just share maybe a little about the safety of this azithromycin.
So, for all the rounds that we've implemented, from the pilots to the scale-up, for the scale-up now we're in the 4th round. So, azithromycin is actually kind of like given every 6 months. Unlike polio that does not follow that kind of sequence, for Zithromax, we give it every 6 months. So for the 6 months, every round, there's an aspect where we monitor adverse events.
Okay, that's
it will shock you to know that the target group for treatment each round is always over 1 million children.
Wow.
And so far, we've not recorded a true adverse events.
Adverse events, you mean side effects.
Exactly.
Okay.
So that's to tell you how safe this medicine is. And we've gotten so many feedbacks from the population that have been treated.
Okay.
This is one drug which is very effective, and the caregivers are always looking forward for the next round so that their children will benefit from that particular intervention.
All right. Thank you very much, Malam Muhammad. All right, viewers and listeners, due to time factor, we are now going for a short break and the program will continue thereafter. Stay tuned and go nowhere. It's still a show, Midday Vibe, on Calicut FM, transmitted on 91.9 megahertz. All right, welcome back, viewers and listeners. It's still your show, Midday Vibe, coming your way on Calipet TV, transmitted on channel 141 on Star Times, and Calipet Radio, transmitted on 19.9 megahertz. And with me in the studio, I'm having the program officer, Site Saver Sokoto, Muhammad Ridwan, discussing on the SARMAN project, which is a current trend, a project that is targeting reduction of child mortality rate in the country, that is the death of children that are below 1 year to 5 years or from 1 year to 5 years. And we have earlier heard about the SARMAN and the purpose. Malam Muhammadia, welcome back to the studio. And let me marry this with a question now. This project, I think the way it is framed is for the masses and is for the public good. So, a lot of people will ask, what is our part in this? That is to say, what do we do to help the project excel?
So thank you very much for that question. I think Sokoto State has been, it's one of the most luckiest states where any intervention that comes up, Sokoto is considered. And Gates Foundation, who actually the people that are funding the implementation of SARMAN. Have had so many projects in Sokoto. Site Savers, as an organization that provides technical support, has been in Sokoto for over 30 years. You understand, implementing different interventions. So one way I think the people of Sokoto will come in to help achieve success is targeted by each of these interventions is to ensure that they avail themselves.
Okay.
You know, it's one thing for you to carry a project to a state. It's another thing for the state populace to see the importance and accept it
and embrace it.
And one of the evidence to show acceptance is when these projects are being done or when the intervention is being done, the masses avail themselves.
Okay.
So if you have a child that is between 5 below, you make sure that he benefits from this project. Okay. We have these vaccinators that go house to house. They are selected in the communities with the help of the traditional leaders. So you can reach out to the traditional leaders and ask more questions if your house is not visited. Okay. My house is not visited during this period. Why? Because of the importance of the intervention. And
I'm entitled, I'm not exempted.
I'm entitled. Another way is using radio stations like Caliphate FM. Listen to them. You get a whole lot of information regarding health programs in the States from radio stations like that and other radio stations. The Ministry of Health is there. The Sokoto State Primary Healthcare Development Agency is there. The Ministry of Women Affairs is there. The Ministry of I think local government chieftaincy affairs. I don't know how
it is the local exactly. Chieftaincy affairs.
So you can also reach out to organizations like that and ministries like that to get more information regarding interventions that are going, so that no intervention passes by without you having the best and the maximum benefits from it. Okay, so these are the ways that the populace can also help.
All right. Yeah. All right, thank you very much. So now let's move to the main critical point of this project. Now, what did you target with the project? Like before you end or after the program, what is your main target?
So I will categorize the targets in two categories.
Okay.
The broad one is to generally improve the health and well-being of the populace in the states where this intervention is being implemented.
Okay.
And the target for the program is to ensure that after the implementation, child mortality is reduced to the barest minimum.
That's death of children.
Death of children below 5 is reduced to the barest minimum. So those are the targets.
All right, thank you very much. But one thing that you mentioned, because when you talk about site savers, people know it to be helping inside. Mostly something that affects Istra, Coma, all these Gira, Idu, and the rest, all the lymphatic paralysis and what have you. Because maybe if you do not describe it with that, people will not even recognize it. So now one will ask, what brings about vaccination of children in this project. So I don't think it's something of question.
So the good thing is donors that actually support programs also look at the implementing support partners.
Okay.
For example, Sightsavers have been working in Sokoto, just as I've earlier said, for over 30 years.
Yes.
So BMGF, in its own wisdom, feel like these people have had a whole lot of contacts with the states.
Yes.
And they feel these are the best people to provide technical support to ensure that we achieve what the project, you understand, is set out, the goals the project is set out. So that's why you see Sightsavers is also putting our hands into, and as an organization, you can't just, you might start with a particular thematic area, but as you grow as an organization, you expand to other thematic areas.
Because of the needs.
Exactly, because of the needs that are provided and the experiences you as an organization have gotten over time implementing. Okay. So Sightsavers is getting her hands into so many child health programs, you understand, just as you said, NTDs, you understand, and all that. So we are open.
Okay. All right, ladies and gentlemen, viewers and listeners, it's now time for you to chip in the program by calling or texting us on our line to ask questions and even seek clarification where necessary on this particular project, SARMAN, which is going to be starting, I think,
on the 15th.
On the 15th of this month. All right, we will ask about that now. Okay. But before then, viewers, the number to call is 090-6000-2022. And you can send a text message to that number. All right, let's listen to the first caller. Hello, good afternoon. Wa alaikum salam. Good afternoon. Good afternoon. Who is on the line, please? Thank you very much. Thank you very much for calling. This is your show, Midday Vibes, coming on Caliphate TV channel on 92.9, channel 14 on Saturdays and Caliphate 92.9 megas. And please, when you do call, stick to the topic of discussion. That's important because we have a focus. We are talking about SARMAN project. And you can send us a text message on the number 090-6000-2022. We have another call. Hello. Good afternoon. Yeah, who is on the line, please? Anas Malami, please, what's your question or in the program?
What are you talking about? You say your right yesterday. You say you're looking for your day after. You don't bring your day after now.
Sir?
What are you looking at? And you say, what happened? Actually, showing now. I say, sit down. Go on to your story.
Maranas, please, can you call back? We can't understand what you are saying at all. I don't know, maybe it's due to network or your articulation. Please, just do call back and we'll make sure that we responded clearly on the question you are asking. All right, Madam Muhammad, before getting another call, let's talk about the starting. When is this program starting? Okay. And where is this starting with is also important.
Right. So actually, the actual implementation that's going house to house,
yes,
is going to commence on the 15th of December, and it's going to end on the 21st of December.
I think,
so we have 6 days.
Next week, Monday.
Exactly. So we have 6 days of implementation when it commences. So within those 6 days, we'll enjoy all caregivers to avail their children.
Okay.
Because these teams will be going house to house in all the 20 LGs, with the exception of Silami, Binji, and Sabon. Yes.
Okay, Muhammad. Now, the scope of your project is Sokoto entirely, except these 3 local governments,
for now,
which are on the reason.
Yeah.
And how did you think is possible to reach each and every household within these 6 days, just a week? That's something that will raise concern.
So you see, the platform we're leveraging on is an established platform, the polio platform.
Okay.
And it will interest you to know that in the polio platform, they use 4 days.
4 days?
To reach all nook and crannies.
Okay.
In Sokoto.
Yeah, but
so for us, adding additional 2 days, just as I've explained earlier on, is because we know what it entails, the timing it takes for a team to vaccinate a child.
Okay.
And move to the other house. So that's why we have them working additional 2 days to be able to cover.
Okay.
So we've done it before. and we've had excellent results. And so we
So
feel 6 days is adequate.
It's adequate
to reach, yes.
Okay, so now let me just go further. Is there any plan for like mop up? Because I think polio have done mop up, and also like they used to plan mop up, so that they will make sure that each and every household is being engaged and being participating in the exercise.
So after the actual implementation, because targets are set for each of the teams to go house to house, if they are unable to meet their targets, they have to go extra days to mop up those areas that they are unable to meet.
Okay.
So just the way it is in polio, that's the way SARMAN is. Because it's the same platform, it's the same strategy, and it's the same supervisors and implementers we are using from the states that are coordinating the implementers that go house to house.
All right, thank you very much for that. All our viewers and listeners can do call us and join the conversation on 09060002022. I'll repeat 09060002022. And you can also send your text message concerning the issue and seeking clarification on the issue of SARMAN project, which is implemented here in Sokoto State by Site Savers. All right, sir. Now, we have heard how important and significant immunizing a child is, particularly when it comes to all these issues that you talk about, like respiratory diseases. All right, so now, sir, I don't know, the Site Savers or these teams you are sending, are they putting into cognizance the problems affecting the children? Maybe someone have developed a sign of maybe any of this particular disease you are trying to cure. Is there any provision for that?
So, for the intervention, we have exclusion criteria as usual.
Okay.
Every intervention comes, there's a target population they are looking at. But even in the target population, there are exclusion criteria.
Yes.
For example, one is from the target that has been set. If a child is not up to 1 month, it's not part of the people you treat. If a child is severely sick and cannot swallow, it's also part of the children you don't treat. Okay. If the child is over 5 years, it's also part of the children you don't treat. So depending on the kind of condition they meet the child, if he meets the criteria to be treated, he will be treated.
Okay.
But if he doesn't meet the criteria to be treated, then he's not part of it. And one of the criteria, exclusion criteria, is if there's an established history of reaction to antibiotics.
Okay.
If, for example, you go into a household and the caregiver says, "Oh, we had a history of XYZ when he was giving an antibiotic," you understand? Based on that, you exclude that child.
Okay.
And the caregiver, being the person that knows better about this target group, also have to sign a consent form.
Okay.
It's more of like an agreement that, okay, I agree that my child should be treated.
Okay, so you mean the caregivers have
Either
their
the mother,
role to play?
exactly, the mother, because they know the history, the medical history of their children.
Okay.
To an extent, they know what he has passed through. If previous antibiotics given, he has reacted badly to it, they can decide not to give consent.
Okay. So you mean before administration of this particular azithromycin,
you have to
the parent will be given maybe a paper just to give consent?
No, it's a verbal. You can give verbal. They ask the parents.
Okay.
Do you agree
are you
that,
okay
are
with
you okay?
administer?
Exactly.
Okay.
And once that is given, the supervisor enters it in her phone. The application we use is called ComCare. And then once that is documented, once they enter, it's documented.
All right, thank you very much, Mr. Muhammad. Before we round up the show, now, we have been facing challenges of intervention. Sometimes in some places you hear that some interventions are there and people are demanding something in exchange of that.
Exactly.
Do you have any measure to curtail this in the implementation of this project? Because it will interest you that, you know, in some remote areas, before you will be even given a paracetamol, maybe you have to align to a particular party or you have to give something. So what did the Site Savers do in curtailing such, or do you have a plan for that?
So Site Savers have been very, very, very intentional because after years of implementation in different states in Nigeria and looking at lessons learned from those implementation, we've understood that the first step of curtailing and ensuring that you have lesser issues when it comes to non-compliance. That's what we call it programmatically. when people don't comply and don't agree to an intervention till they are given something. It's called actually non-compliance. It's to ensure that you have a robust awareness.
All right. Thank you. We have a text message here from Mr. P where he's saying this one. The first question is hours for the radio station. He's asking where is the Mr. Lantana Yusuf Odarinde, which I will tell you that she is good and healthy, and she's just embarking on some serious activities that is detaining her from being on air. But soon enough, as she's done, you hear on air, God willing. So he's asking, can they adults come to your office for free eye care? Thank you, by Mr. P. So, Sight Savers.
Good enough. Sight Savers has done a great job when it comes to eye care.
Okay.
With the technical support of Sight Savers, we've had so many static centers established to take care of eye diseases. We have one in specialist hospital. We have so many general hospitals in each of the LGs. So, our office, we're a project coordinating team there.
You are there for administration. Yes.
But for where the technical people do the technical work, these are the places I've called. You can go to general hospitals.
Okay.
And then you can also go to the specialist hospital. So we have an established eye care center there.
All right, so I hope Mr. P have had his question answered, and what we hope is he will allow his children to be given this azithromycin. And if you have not for once seen the enumerator, let me say vaccinators, then you should do call Caliphate FM. But we are going to see you, Malam Muhammad. For all right, thank you very much, Mr. P. All right, so Malam Muhammad, now we are discussing on the measures that you took in ensuring that each and every household have
so having a robust awareness creation system and carrying people along go a long way to curtail issues of non-compliance. Like what we are doing now, we're trying to create awareness for people that listen to Caliphate Radio. They already know that this program is not a program that's related to politics. It's for all and sundry.
Okay, so no political party.
No political party. Whichever party you are, as long as you are an indigent or resident of Sokoto,
you are entitled.
To benefit from the intervention. That is one. The second aspect is carrying along the necessary stakeholders.
Okay.
You see, when you're about to implement a particular program, stakeholders management is a key factor for the success of that project.
Yes.
When people see you aligning to a different party, that's when they have that idea to say this thing is politically related. But when they see you having mixed set of stakeholders, like for us, both the government, the traditional institution, the religious institution, everybody that has one or two things to do to influence the program is carried along. So by the time you have a robust system that does that, carry everybody along, I think you reduce this to the barest minimum.
Okay.
And it's good, again, for you to advocate and enlighten people to know the importance of the intervention you are bringing. If I know the importance of something, I wouldn't say I'm requesting for either a cup or sweets before I take that thing, because already I know that thing is important to my health. So putting all these things ab initial in the planning goes a long way to reduce issue of non-compliance.
All right, thank you very much, sir. And due to time factor, I think we should be wrapping the program here. But before then, Mr. Muhammad, let's hear your, I will not say final words, because we are going to be seeing, I'm very much sure we'll see, because we are in this and we have to go through it together. So now, what would be your advice, or let me say a note or a message for the populace of Sokoto State?
So my message to them would be, SARMAN is here. Let's take advantage of it. We never know when kind of like programs like this that are of utmost importance to the health of our children will be here again. So while this lasts, let's take advantage and let's not leave anyone behind.
All right. Thank you very much, Mr. Muhammad. And viewers and listeners, here we come to the end of the show, Midday Vibe, today's edition. But before I wrap it, I'll say our future lies in the hands of the type of children we bring up together, or we bring up next. And we can do that only if we provided a conducive and healthy atmosphere for them to excel. Children are dying day by day before they even attain maturity because of these neglected tropical diseases and some other diseases that we fail to address right from their childhood. So it is our own responsibility individually and collectively to protect these children and make sure they are safe and they grow safe to uphold our values, cultures, and our communities. These organizations are there to support us in ensuring that we have done the necessary. We shall all give heads and put in our best in ensuring the success of this project as they are meant for the good of us and our communities. From the studios of Calicut TV, transmitted on channel 141 on Star Times, and Calicut Radio, transmitted on 92.3 MHz, on behalf of the production team, I am Mukhtar Egonga. Invite you to keep watching Calicut TV, transmitted on channel 141, and listening to Calicut Radio, 92.3 MHz. Have a wonderful day ahead.